What's going on? I'm Dr. Caleb with Incline Performance Therapy. If you're watching this video, you're probably having pain in the TMJ, and I want to give you a few exercises that you can perform on your own to alleviate pain in that joint. So the first thing we want to do is actually to perform massage on the muscles that are responsible for chewing and moving the jaw. The two ones we're going to focus on are the masseter muscle, which you can see right here as I clench my teeth, and the temporalis muscle, which is up here, and you can see that when I clench as well. So you see those muscles move a little bit. Now what we want to do is take a flat hand and press right on those muscles, and you can feel them when you clench your teeth. You see it push my fingers out. That's where you want to massage, and you can just apply a sustained light pressure to that muscle. Find a tight area, maybe hold that for about 30 seconds, and then move on to the next tight area. You can also perform that same technique at the temporalis muscle. Again, clench, you can see it move my fingers, I'm on the right spot, and I'm just gonna massage that area, finding tight spots, and holding for about 30 seconds apiece. Next, I want you to hook your thumb behind the jaw on both sides and mobilize your jaw back and forth in an alternating fashion. This should not be a painful mobilization, so don't push so far back and forth that you cause pain. After this, we want to open our mouth slightly and press our thumb on the bottom of our chin, and we'll resist that pressure by keeping our mouth open slightly. We'll then perform the same type of motion by keeping your mouth slightly open and pressing on the side of your jaw and resisting any side-to-side motion. We'll then perform the same exercise on the opposite side. It would be good to hold these positions for about 30 seconds. Next, we're going to progress those last three exercises by opening the mouth as wide as possible, apply that pressure to the bottom of the chin and hold that position. We're going to maintain that open mouth position and apply pressure to the side of the jaw before performing on the opposite side. Again, holding this position for about 30 seconds would be ideal. This one's a little funky. We open our mouth and put our tongue at the top of our mouth, and we're just going to open and close our mouth as wide as possible while still being able to maintain contact with the top of your mouth and your tongue. Here we're going to stretch some of the neck muscles by looking straight up towards the ceiling and opening and closing your mouth as wide as possible, maintaining that stretch the whole time. If you suffer from neck pain, this motion might be a little uncomfortable, and in that case it'd be okay to avoid. For this last exercise, we're going to hook our thumb around the back of our jaw on both sides and cup our face with our hands. Then we're going to push up towards the ceiling and stretch the neck a little bit, and then we're going to tilt our head side to side, maintaining that upward pressure with our hands throughout the motion. You can see the wrinkles on my forehead. I'm pushing upward pretty hard with this exercise, and usually it feels pretty good on the jaw and the neck. I hope this is helpful for you. If you feel that you're still having issues after doing these exercises, you might need further evaluation. Treatments such as dry needling have been shown to be really helpful for folks with TMJ issues.